Well, good afternoon. I'm Lee Harris, Mayor of Shelby County, and pleased to be here on behalf of the Joint Task Force. First, a few announcements before we welcome to the podium the Director of our Health Department, Dr. Haushalter. First, we are preparing to bring to the Shelby County Commission on tomorrow a proposal for a second round of municipal relief for 6 cities in Shelby County: Arlington, Bartlett, Collierville, Millington, Lakeland, and Germantown. The second round of municipal relief plan calls for a $3.4 million transfer to those suburban cities to help support their COVID response efforts. This $3.4 million will be divided as you can see on the screen right now. This is our second municipal relief fund with the municipalities. It'll be, again, on the commission on Wednesday. It is being sponsored by former Chairman Mark Billingsley, who's really been a leader in structuring these programs so that we can make sure that each of our municipalities has access to resources so that they can mount a COVID response. This is, again, the second round of relief in terms of CARES dollars that the county has provided to the suburban municipalities. In the first round of municipal relief, which happened at the end of May, we provided about $6 million to the suburban municipalities. Just an additional reminder for background, in case you're wondering, only the city of Memphis and Shelby County were allowed to directly apply for COVID resources from the federal government. The suburban cities that I mentioned, those 6 cities were not able to apply for relief directly from the federal government. However, these municipalities are working aggressively to confront COVID and to slow the spread. And we all know that this virus has no boundaries, and that the only way we're going to mitigate risk is for all of us collectively to work together on our COVID response. The task force, speaking of making sure that we're all working on this, the task force continues to partner with our neighboring communities, particularly our more rural areas. The data has been moving around quite a bit, but we want to make sure we're collaborating as much as possible with those rural communities. In fact, according to one media report that caught a lot of attention that appeared in the Commercial Appeal recently, our neighbor to the northeast, Haywood County, has some of the highest numbers in the state, around 102 cases per 100,000 in population. That's why several days ago, the Shelby County Health Department sent a strike team to meet with officials from Haywood County and discuss several ways we can deepen our partnership with that rural community. We'll report out on the various ways that we will collaborate with Haywood County and try to slow the spread there. Suffice it to say again, this virus knows no boundaries, and the threat of spread in our nearby rural communities is a threat to Shelby County.